Procure4Health has been a game changer. From the beginning, our objectives were very ambitious. We had to build a large community of peers based on the confidence and the knowledge among the members. We have to build up the capacities and skills of those that have to work on the ground to perform procurement of innovation activities. And we had to disseminate the benefits of the instrument among healthcare organizations all over Europe.
We wanted to be a very highly active community, and we actually intentionally chose the word community over the word of network because we imagine a community works better together. So the idea of this platform is for us as community managers, we wanted to provide the members with information from our sites, but we didn't want to limit it to a one-way directional way of providing information. We wanted also to have engagement and for members to interact together.
Healthcare needs innovation, and I truly think that no one can do it on its own. I really believe in the value of communities because this is, I think, how we are able to drive change, how we can create impact, and we don't know it all. So we really need each other to leverage the information, the knowledge, the people.
I think what was also important that I rediscovered how powerful is working in a team. Everybody who wanted to gain something and wanted to do something could always count on other people. So if we had a problem with X, we can just talk to person A or B and they'll be willing to help us. It was, I would say, very sincere. It was not that they helped us because they should do that, but they helped us because they believed in the project. And I think this was really something that I would like to experience more often.
When we work together with other regions that have exactly the same issues to solve as we find it very natural now to work together, to share information, and to be willing to seek common information benefits our daily tasks.
The main challenge was to align different interests and profiles, understanding who was in the room, not only the organizations, but also the persons. What were their needs, their struggles, their expectations, and their interests, and aligning the activities of the Procure4Health community to them and not the other way around.
One of the main outcomes of the Procure4Health project was a so-called action plan, where we tried to develop together with the procurers we have in our community a practical guideline of how they could leverage innovation procurement as a strategy to tackle prevalent challenges in health and care. Our community is pretty diverse, so that was one of the things we discussed quite lengthy at the beginning, because it is difficult to agree on like 6 or 4 common challenges that really all procurers have and could agree on.
Health systems around the world are adopting value-based healthcare in response to the pressures they are facing. It's a fantastic opportunity for procurement professionals to really make a difference to the outcomes for patients and to help create sustainability in the health system.
The procurement is not a national issue, it is a worldwide issue, and the first thing is really to have a reflection on European level. And the project Procure4Health was really one of the first starting points, an initiative from the European Commission, from the European Union, to move forward the coordination inside of the healthcare sector, particularly for procurement. We have also decided that the fuel for making forward, for ongoing the system is the value-based approach. And this for me is one of the biggest outcomes from these 3 years of working together.
As a procurer, the main benefits have been in two directions. One is obviously that related to have partners, colleagues, other organizations with whom to share risk, projects and ambitions. And the second one has been the building up of the capacity of the team that I coordinate. If we look what we were able to do, what we felt that we could do 3 years ago, and the type of projects that we're engaging now has really built up, and Procure4Health has had a big part of it.
We have hopefully all learned that 1 + 1 is more than 2, and that in a lot of different heads are much more solutions than in one only head, and that the approaches from the different countries are not in an opposite, that they are complementary.
The continuation of Procure4Health is actually something way bigger in making sure that we're bringing together all the other communities that are out there to enhance and improve healthcare procurement from that lens of where we started off with Procure4Health.
Now Procure4Health is finishing, but we plan to keep on working on this. We are joining other initiatives like big buyers and other networks. So after Procure4Health, we will continue to deliver guidelines, we will continue to deliver support for procurers, healthcare organizations, the ecosystem.
Also the case of this project, this will be over and that's it, but the bonds stay. So I think that there's some sort of a legacy, not in a sense like, everybody's going to talk about this project for the next generations, but there are people who learn how to work with one another, and that there's something on which more project will be built.
The procurement of innovation is possible. Implementing them in healthcare organizations is not easy. We are probably among the more complex organizations, public organizations around, but that it is our responsibility to make it happen because it can bring so much benefits to public health. That is what.